You can see like participants on there. Okay, awesome. All right, we'll give people another minute or so to join here, and then we'll get started.
So what was the instruction? You'll call on us to answer?
Yeah, yep.
Okay.
Should we just get started?
Yep.
Okay. So hello everybody, I'm Talia.
And I'm Tegan.
And we're on like the exec board for the pre-health conference this year. But welcome to Iowa State's pre-health conference. So in this session, we will be hearing from physicians on their experience with grad school and as well as their work life. So first I would like to start off by having the panel introduce themselves. So after I say your name, just give a little background about yourself. So like where you went to medical school, what your specialty is and where you work. So we'll start with Dr. Scott Larson.
Hi, everybody. My name is Scott Larson. I'm originally from Iowa. I'm from Council Bluffs originally. I did medical school at Iowa, and I haven't left Iowa City since then. So I am currently a family medicine doctor. I do geriatrics as well. So this is like my 11th year in Iowa City or something like that. So.
Awesome. And then Dr. Sarah Bancroft.
Hi, so I'm Dr. Sarah Bancroft. I grew up in the Quad Cities and I went to Southern Illinois for undergrad and then Kansas City for medical school at KCUMB. I ended up in Grand Rapids, Michigan for my residency, did a year in urgent care and then did my sports medicine fellowship. So my specialty is in sports medicine. And I currently am practicing at McFarland Clinic, which is a large multi-specialty group in Ames. And then I'm also one of the team physicians for Iowa State University.
Awesome. And then Dr. Beth Larson.
Hi, I'm Sharon Beth Larson, and I'm a cardiac surgeon at the University of Iowa. I grew up in Texas and went to medical school in the San Francisco Bay Area at Torrey University College of Osteopathic Medicine. And I did my general surgery at NYU Langone Brooklyn Hospital in New York. And then did my cardiothoracic surgery fellowship at the University of Minnesota and a thoracic transplant and mechanical circulatory support fellowship at Duke University. And then came to the University of Iowa for my first faculty appointment in November of 2016. I've been there since.
Thank you. And then Dr. Bailey.
Hi, my name's Olivia Bailey. I grew up in Waukee, Iowa, and attended medical school and residency at University of Chicago. And then I moved back to Iowa City for my first faculty appointment as well right afterwards. And I am an emergency medicine physician.
And then Dr. Erdahl.
Good morning. I'm Lillian Erdahl. I am originally from Iowa City, and I did my undergraduate at Iowa State, and then I did medical school at Penn State in Hershey, Pennsylvania, followed by a residency in general surgery, and then a fellowship at Mayo Clinic in Rochester, Minnesota in breast surgical oncology. And I've been at the University of Iowa since 2014, and that was also my first faculty appointment, so it seems like it's a theme. And right now my practice consists of breast surgery and a little bit of melanoma.
And then Dr. Bassner.
Is it, oh, am I gonna, sorry. I don't know how to use Zoom. I am an internal medicine physician. I went to Michigan State Osteopathic. My husband is from Iowa, so he dragged me here. And I've worked for Unity Point and Mercy, and now I'm happily employed at McFarland Clinic. And I do mostly clinic, where I take care of adults and a little bit of hospital work as well.
And then we have Dr. Becky Davis Kramer.
So I am originally from the East Coast. My husband and I moved to Iowa many years ago. I went to DMU, and he did his PhD at Iowa State. always intending to leave the Midwest, but here we are. So we're still in Iowa. I did my residency in Des Moines in family practice before there was an emergency medicine residency available in Iowa at all. So I trained under the mentor who taught me emergency medicine, but it was actually family practice. So I'm old enough that I've got dual boarded in both. And so now I've been practicing emergency medicine in Central Iowa for the past 31 years. Still doing it. I've worked now at Broadlands in the county hospital in Des Moines in the emergency department.
Well, thank you. We're excited to hear from all of you today. So to start us off, we have a couple general questions that anyone on the panel can pop in and answer. And then students, if you have any questions that come up along this Zoom, just feel free to put them in the Q&A box and we can get those answered as well. Okay, so the first question that we have is, why did you choose your designated profession? And anyone on the panel can start.
I'll start. I wanted to do primary care. I always thought I would do some sort of primary care. I ended up choosing adult medicine because I thought, well, if I want to do a fellowship or specialize, there's more options from internal medicine as opposed to family medicine. And I kind of just ended up in clinic through a series of jobs that were not great fit for me. I like clinic. I love taking care of families. I have parents and then I'll get the kids once they graduate from pediatrics. I've been in my current practice for almost 5 years, so I have a mature panel now. And most days it's just a delight to come to work, and I get little Christmas gifts and I know what's going on with people. I enjoy the relationships.
All right, Dr. Bancroft.
I'll go. I went to medical school. I figured that out when I was probably a junior in high school, that I thought maybe I wanted a career in medicine. I hadn't done a lot of experience on the side of watching what doctors do. It was more on the side of being a patient or a family member. And when I got to the clinical rotations in medical school, it was really the living anatomy that sort of first captured my interest in surgery. And I think, there's still something amazing to me every day about getting to see the living anatomy, and it's different from patient to patient, or, in my case, I do a lot of cancer from one cancer to another. And breast cancer in particular was of interest to me because I like the connection that you establish with patients. And I like sort of being a part of, not just 1 or 2 visits with them, which is sometimes what happens in general surgery. Maybe I meet you in the emergency room and then I take your gallbladder out and then I see you one more time. But it's more of a longitudinal relationship. And, I really enjoy being able to connect with my patients. And I think they give a lot to me. It's a two-way exchange in the human spectrum. So.
In sports medicine, I grew up doing a lot of sports in my life, and my family was always very into that. I initially wanted to actually do PT, and I did a large amount of shadowing between my first and second year of undergraduate. And at that point, I was a little bit undecided if that was where I wanted to go. And I met somebody who was my future spouse, who's my husband now. He's actually an ear, nose, throat surgeon here. And his mother was a osteopathic physician. And so kind of encouraged me to look into that as a specialty, and specifically in osteopathic medicine, there's a large emphasis on musculoskeletal and whole body wellness training that's additional to the traditional model of medical schools. So I really liked that and felt like that was going to lend itself well to a career in sports medicine. And then I was actually a little bit opposite of Shauna. I wasn't sure what type of specialty I wanted to do. And with regards to family practice, I actually never thought I'd do my residency in family practice because I thought it was way too broad for what I wanted my practice to be, and honestly overwhelming because I think it's difficult to manage everything for everyone. So I ultimately chose a residency that I could do kind of a hybrid model, I guess would be the way to say it, where I did 2.5 years of family and then 1.5 of the sports medicine. And have been really happy with that choice and really appreciate now where I am being able to work with not just community-based athletes, but also the college, and starting to get a little bit of primary care for the athletes back, where I do get a little bit of the long-term relationship. I'm in my 4th year here in this practice, and it's going to be hard for me to see the athletes who I've been with since they were freshmen and doing their intake physicals, and then seeing them month to month or year to year, and they'll graduate. But I also have kind of a sporadic practice where people come see me for issues that are maybe 2 or 3 visits for a particular injury, and then I won't see them for a year or 2, or I'll see their family members in between, like Shauna said. So yeah.
Okay, we're gonna go ahead and move on to the next question. Dr. Bailey, if you'd like to start with this one. What is some advice you wish you would have known as an undergraduate student that would have helped you in your profession now?
Well, I guess I would say to be a well-rounded applicant for medical school, there's kind of multiple things you should consider or do. Obviously, having some experience or shadowing, something where you've seen the position so you know if it's a fit for you or not. I think volunteerism is super important as well. Some undergrads will have research. I don't know if that's like a must-have. But I think probably just having some exposure to know if you're going to like it or not like it would be helpful before you. I mean, it's a lot of training and a lot of schooling, so you want to be sure it's a good fit kind of prior to that.
Dr. Scott Larson, do you have any extra things to add?
I would just echo what Dr. Bailey said. I mean, I completely agree. Shadowing is really probably one of the most important things. I mean, because there are a lot of health professions out there and they're all a little bit different. I didn't do a ton of shadowing, and I think I just got lucky that I love my job now, that I ended up in the right profession. But I mean, some people really, probably are better suited to physical therapy or pharmacy, or, maybe doing like a physician assistant track or something instead of doing the whole like medical school and then residency and then fellowship, if applicable. Track might be a more appealing pathway for people. So yeah, I think shadowing is really probably the biggest thing. And I sat on the admissions committee for 3 years, and that's really a big deal trying to get into medical school. It's just, the committees are really want to make sure that applicants have like seen what being a doctor is like, and really kind of know what they're getting themselves into before they commit to this track.
Awesome. Does anybody else have anything to add to that one at all?
I would echo what my colleagues have said previously. And just to add, whether it's shadowing in the clinic or in the hospital, in a nursing home, but understanding how you need to relate to patients when they're at their most vulnerable. It can be emotionally exhausting for the physician as well as for the patient. And that's a skill that is not often taught. And so you can learn all the science that you want in medicine, anatomy, technical procedures. But if you're unable to connect with patients really when they're at their worst, it's going to be a very challenging career path. No matter how excellent your technical skill or your scientific knowledge, you have to be able to connect with those patients. And so developing those, searching out those opportunities where you have the opportunity to connect with patients, to understand their experience better, and the incredibly important role you have in restoring their quality of life is a worthwhile endeavor when you're an undergraduate.
And then we have a question in the chat. Is there anything that you wish you would have known about medicine before you went into it or started practicing?
I wish I would have known that people can be very difficult to help. I think you want to go into the helping profession and you want to help people, but I think being in primary care, life is hard. And so much of, I think, helping people get to their health goals is realizing where they are and where they want to be. And there is a lot of stuff in the middle. I don't think I appreciated that when I was younger, not to be condescending. And I also want to echo the advice my colleagues just gave and also mention, I wish I would have had some financial education. I think I've made some dumb mistakes with money and I wish somebody would have helped me out, or I would have known earlier to seek out like what I should do with my loans. And I don't think I understood what compound interest really meant when I graduated with $250,000 of debt. I don't regret what I did. My life is very pleasant. I mean, I have a great job, I have great benefits, but it would have been nice to have a little bit more mature financial viewpoint moving forward.
Does
Yeah, I
anyone-
think looking at debt, debt burden and lifestyle, like it's hard to think like I need to know what I want to be doing with myself in 10 years. But, there's obviously, do you want to have a family? How is your spouse going to play a role in what your career is like? How will the finances play a role? And I think all of that, again, no regrets here either, but there are some things that I think looking long term, if you can find a mentor that you're shadowing with and doing things with, they can hopefully talk with you frankly about some of the pitfalls or positives that they've gone through that could be helpful for you too.
Bouncing off of what you just said, how are you able to balance your outside life with your work?
I can speak to that. So having done this emergency medicine now for 31 years, I raised 4 children. I have 5 grandchildren right now. It's been a challenge to say the least, but I would say one of the most important things that I've learned, and that is to be careful to cultivate a passion outside of medicine, something that helps you to sort of balance your life, because the truth is that medicine, a career in medicine, can be a really tough taskmaster and can take over your life if you let it. This past year working in the ER with COVID patients has been a huge challenge for most of us. And it's when you have to have some kind of emotional reserve to be able to do it. And I think a lot of that comes from an outside passion that you can put the medicine down for a while and go do something else for a little bit. And I think that that's probably for most careers, but certainly a career in medicine, you have to have something else that you're passionate about.
I think also just having boundaries. I really hear it from my patients who, they'll struggle with any overwhelming job and then they realize their job has taken over their life. I think you have to know what you want and set those boundaries. I was really glad, Dr. Larson, to see you on the panel. I think it's awesome to see a woman surgeon. I think you can build your life the way you want to in medicine. That's one of the awesome things for me in primary care. I've never called a place and said, hey, I'm looking for a job and had them say no. I've been able to do research, which has been really engaging for me. There's just so many choices, but I am always thinking about how I'm going to get home for dinner on time and how I'm going to have most weekends off and how I'm going to be able to take 2 weeks off at a time. I like to travel internationally, not at the moment, but that stuff is really important for me. So for me, it's always lifestyle first, and then, money, those things are secondary priorities for me. I think you have to do that in any job.
I would like to recognize my other female surgical colleague, Dr. Erdahl. I really think we need to hear from you how you balance your exceptionally rich life, both professionally and personally. I am not attached. I have no children. And so it's very easy for me to default to throwing all of my time and energy into work. I'm often the last one that leaves the office at the end of the day and the first one in, but I don't have as many outside personal demands of my time. And so I'd like to turn it over to Dr. Erdahl because she makes it look easy.
Thanks, Dr. Larson. It's You know, it's not easy. And actually, one of the women surgeons I look up to calls it work-life integration, because it takes the pressure off that there's this idea that you have to have balance or be perfect at it. And that's really helped me. I think the other lesson that I've learned, and I got a lot of advice as a medical student that was unhelpful to me, that, was based on somebody else's idea of what my life should be. So I really think that what I wish somebody had told me sooner was, you get to decide. And I think Dr. Bassner sort of said that, right? It's not just about what career you pick, but it's about the job and how many hours you work and what else is important to you. Dr. Davis Kramer said, have a passion and decide how much time that passion needs. And don't apologize for getting help. I pay, for somebody full-time to help clean my house and get my kids' lunch ready, because I have to be in the operating room at 7:30 in the morning. And so, I can't drop my kids off at school every day. And that's just what's worked for our life and our family. But then other days I like to take a random vacation day in the middle of the week. And then that way I just have a day to sort of decompress and do the things that are important to me. So, you get to decide. I think that's really my message.
Okay, it looks like we have a question in the chat. It says, what is the most difficult thing about the path for medical school, actual medical school residency, getting in medical school, or is it more about the pressure and stress of a medical profession?
Well, every point in that timeline presents its own unique challenges. So I think if you're ready to travel that pathway, you have to be prepared for challenges at every level. I think in medical school, the challenge is a lot of time, learning how to manage your time best, because there's so much information to learn in a limited amount of time. In residency, that time management becomes even more critical, because you're still learning more of the practice of medicine and still learning more of the scientific background that's necessary to carry out your subspecialty that you're choosing to learn about in residency. And there's a limited amount of time, right? There's work hour restrictions. So then you really have to be able to manage your time even better. In addition to now accepting that responsibility of someone's health and well-being and survival really is now in your hands in residency. And then when you enter into your professional practice, all the responsibility is yours, right? It's your license, your reputation, and the outcome. Everyone's going to look to you, whether it goes well or doesn't. Hopefully more times it goes well, but there are some really sick people that you're going to take care of. And then on top of that, I found that starting at the faculty level, no one had ever really told me I need to be thinking about the financial implications of what I do from an institution perspective, right? So suddenly now I have administrators making suggestions on how I should practice medicine to be more financially responsible. And that's not something that I had ever been presented with until I got to the faculty level. You just have to stay motivated and continuously remind yourself of that passion that got you in the first place, because every step along the way is going to be tough. But if you remember what got you started in the first place, that will keep you going and continue to keep you motivated.
I always remember thinking that getting into medical school was the hardest. And then once you have, like, now that I have my degree, again, I just feel like there's so many choices and so many cool things I can do. There are a lot of hard things about being a doctor, wrestling with Blue Cross Blue Shield, not my favorite thing to do for sure. But there are just so many options. It's really overall a pretty good gig. I think in the current environment, there's a lot of, keyboard warriors and disrespect. And I think, police, teachers, firefighters, they're all under different things in their field. Doctors are certainly no different. I think that we're in a place where we're really confronting a lot of issues in medicine. But it's a great profession. The relationships are great. Clinically, it's very stimulating, super secure job once you're in.
So we have a question in the chat. It's about like shadowing opportunities during COVID, or like any tips for students trying to obtain shadowing experiences. So for example, like how to best approach a physician, what things to have prepared to bring with you, and like what to wear, all that.
The good news is, I would say majority of us are double vaccinated, and there's a lot of debate about that, but hopefully shadowing opportunities are a little bit more readily available because our staff are not as fearful, we're not as fearful, and it's not going to knock us out for several weeks of work and things like that in most cases if we roll the dice right now. So that's a good thing. I think it's really important to do the basics when you show up to shadow, and that is be on time, which is actually 5 to 10 minutes early. Make sure that you bring something that you can write some notes on or questions on, because it's important that when you're shadowing that you're being very attentive to what's going on, but maybe not necessarily interrupting with every single question you have. So writing those questions down and then also taking feedback is really good. And that's what I do with my medical students and residents that I have come up and shadow me as well. And the ones who get better as the rotation goes on and get more knowledge are the ones doing those things. And then just being really respectful to staff and patients, and just knowing that when you're an undergrad and shadowing, that it's your job to learn. And if they ask you to assist, I used to do basic things in the ER, like stock the shelves with linens and, things like that, like totally not medical things, but they're helpful. And if you're asked to do something like that, go ahead and jump in and do it. But yeah, smile, be respectful, listen, and take some good notes, and you'll do fine.
And students, Dr. Erdahl just put a shadowing opportunity in the chat if you missed that.
Does anybody else have anything to add to that question?
There are some virtual shadowing opportunities right now. And I think that would be worthwhile to explore, especially with so many in-person opportunities being limited right now. So I would pursue those virtual shadowing opportunities as well.
I just wanted to add, don't email Shauna and ask if you can shadow in her clinic. It's Dr. Basner, always. Don't be rude to my nurse, because as soon as you leave, she's going to tell me how terrible you were. That's happened. Don't come and yawn the whole time. Don't do that. And then as far as clothing, I would say in general, business professional. We're in Iowa, it's pretty chill, but for, look professional, kind of what we're all wearing on the top, and then some professional slacks on the bottom. If you're in the ER, probably they're all wearing scrubs. I think that would, that would be fine, I would imagine.
Okay, I'll direct this question to Dr. Larson, Scott. How important were your grades and GPA in medical school when you were looking for jobs?
I'll clarify too, I'm also not related that I know of to the other Dr. Larson here. So we get each other's mail every once in a while, I think, and faxes, but yeah. So how important were my grades in medical school and college? So not very. They kind of were. So I did family medicine. Family medicine, there are a lot of programs, so it's, a little bit easier to get into in that way. That's not why I did it. It's because I like primary care, but grades certainly matter, but the really, the more like hyper competitive programs, like, like an ophthalmology program or something like that, or orthopedic surgery, those tend to be, there's just fewer slots, and a lot of people want to go into those professions. I think they look a lot more at like grades in medical school and whatnot. Nobody looks at anybody's college grades once you're into medical school, you're in, and then kind of everything before that generally doesn't matter. And then like just trying to get a job after residency. I don't think anybody cares about your medical school grades. The old joke is P equals MD, right? So if you pass everything, you're still a doctor. But yeah, no, it's, grades, they have some role. They're important. Obviously, like it's important to getting into medical school, having a, pretty good GPA. There are ways to mitigate if you don't have a perfect GPA or an excellent GPA or even a good GPA, you can still recover from that. Generally with like good MCAT scores, and also just by having a really well-rounded application in terms of lots of shadowing, which again is a little tricky in the era of COVID, but just doing what you can. And then a lot of like volunteer work and just kind of showing that you are, an altruistic person who's interested in helping people. I think, that I remember again on the admissions committee, we admitted a lot of people who did not have anywhere near a 4.0 GPA. And because they were just overall, well-rounded candidates.
Thank you.
And then we have another question in the chat. And we'll ask Dr. Bailey this one. What helped you focus on your path when entering such a competitive environment? What did or do you do to refrain from comparing yourself to others?
For me, emergency medicine, I didn't know kind of going into medical school, it was of interest to me, but I did some research after my first year in the ED, and I just loved the environment and the craziness of it, which some people probably would not like, but I love it, and the unexpectedness. So I knew right away that it was a good kind of fit for me. And I think kind of, especially in emergency medicine, there's just such varied interests, at least in my department amongst the faculty, that you really can't compare yourself to someone else. Like someone's got specialization in ultrasound, which is awesome because it helps everyone, but like, that's not my specialization. So I think just recognizing that everyone has a valuable part kind of to play, on your team, your colleagues, et cetera. You just kind of focus on your own interests and your own passion, and it all just seems to work out fine.
Okay, Dr. Davis Kramer, what parts of your job make you want to keep going to work every day?
I love I would piggyback on that. I love the team aspect of the emergency department. I love being able to depend on a really sharp radiologist that works with us, or really good respiratory therapists, and together bringing all of our skills and passion into sometimes really critical incidents where we just have to try to rescue somebody. And I love that being part of the team and being able to count on each other. That's one of the things that I have always loved about emergency medicine. And the other is patience. That very often, especially in emergency medicine, but I think in many specialties, we have this privilege of interacting with people on the worst day of their lives and trying to make a difference and trying to help that and trying to bring a sense of compassion to them, recognizing their dignity. And I absolutely love it. I love being able to interact with people, especially on those horrible days for them, and just kind of walking alongside them and trying to be as supportive as we can be. I've had times in my career when I was sort of ready to throw it in, but the truth is that what keeps me coming back is the patience.
So we have another question in the chat. What would you recommend for studying for the MCAT? Self-study, specialized classes, and anyone can start on this one.
Both.
Either, yeah.
Right. So I think there are some excellent courses that help take you through the entire gamut of information that's going to be covered on the exam. But that is really just to help direct your own self-study then. So it would be both. So my recommendation would be to sign up for a specialized course and then do additional studying on your own, and as many practice exams as you can take.
I would say can I just say really quick too? I mean, I think a lot of it just depends on your learning style as well. I mean, I think doing both is a good idea. I personally just had like one of the textbook that was about that big of, MCAT prep stuff, and kind of, I made a study plan and worked through it throughout, I think basically an entire semester. I kind of gradually worked through it. And then I think within like the month leading up to the MCAT, I went through the book again or something. That was a while ago now. I don't remember all of my details, but if you're somebody that like just really needs somebody else to structure this for you, I would absolutely recommend doing a class. If you think you can really rigorously like hold your own feet to the fire to stay on task, then you could potentially get away with not doing one.
Thank you. And someone asked, what is the difference between clinic and hospital work? So if anyone wants to take a stab at that one.
Go ahead.
Dr. Larson, you.
Okay. I do both. So I mostly do outpatient family medicine and geriatrics, like I mentioned earlier. I do hospital stuff about 5 or 6 weeks a year, and then I take call. The hospital side of things, you get a little bit more instant gratification, or at least, shorter term gratification. Like somebody comes in very ill and they're a lot better by the time they leave, and you get to see that happen as a result of what you've done. So in that sense, you get a little bit more instant gratification. That's actually one of the reasons I like doing it. In family medicine, I do a lot of primary care, which is a lot of preventative care, which means if I do my job right, people won't think I did anything at all, right? So, sometimes it's hard to, or even just managing chronic diseases, it's not you don't get a ton of you don't get that dopamine rush from like, oh, good, I prescribed another blood pressure medicine today. Whereas if somebody comes in with severe heart failure exacerbation and they can barely breathe, and then they're feeling great by the time they leave, that just kind of instantly feels a little bit better. But otherwise, the hours are usually different. Usually it's longer hours, usually get up earlier in the morning for kind of hospital work compared to clinic. But on the flip side of that, clinic work, you're sort of a slave to the schedule. So if your patient shows up 10 minutes late, well, you might be 10 minutes behind if you can't get them, if you can't get your day back on track. Versus hospital work, you're kind of just doing your own pace and, drinking coffee in between patients and whatnot. You get to kind of schedule your day a little bit more to your liking, compared to clinic, where it's really like every 15 minutes or every 20 minutes or so, you have to see the next person. Otherwise, you're never going to finish.
Thank you. So the next question that we have in the chat, there's often a debate of if medicine is a calling or career. How do you view this conversation, or how does this manifest in your day-to-day work?
I'll take that one to start. I think for me, the question is this just a job or is it an avocation? And I think to be successful in the long term, it has to be a little bit of both, because you have to be passionate about it, and you have to be willing sometimes to make big sacrifices and sometimes to make small sacrifices in order to provide the best patient care. And you have to be willing to deal with the lows that come with either the stress of the job or a patient not doing well. And to get up and go back to work the next day or the next week, you really have to love it and be passionate about caring for people. But also, I think back to our conversation on balance, you can't give it all of yourself, because if you give it all of yourself, you have nothing left to give, to your patients or to the people in your life. So you have to find a way, like Dr. Bassner said before, to put some boundaries around it. But I think if it's not something you feel strongly passionate about doing, it's hard to sustain a career in it.
I think the big thing to kind of summarize that a little bit, because you guys have been asking a lot of questions about, medical school, residency after, all of us have been in our practices for a while. There's not a ton of flexibility in medical school and residency. There's ways to have some flexibility here and there, but during that time, the dedication and calling and things like that is really what's driving you through that time. It's anywhere from, it's a minimum of 7 years, but upwards of 10 to 12, depending on the specialty that you choose. After that, as you start to get into your practice, it's almost like this very odd, like pressure valve lifts. And you're like, wait, you asked me what I wanted with my schedule. You asked me what I thought about how to set up my exam rooms, or how, when I wanted to take a half day off, or when I was going to take vacation, and it's not based on the other residents that are in my fellowship, or, so that time can be trying. Again, there's definitely ways to continue, but what I think it was Dr. Davis Kramer said about having something you enjoy, that is really important. You might not get a lot of time for that during medical school and residency, but after that, it's super important to kind of sustain yourself with something that you enjoy to do as part of your life. But I think it's good to maybe quantify a little bit that the time of medical school and residency are unique, and they are stressful, but they are kind of a means to finishing and getting to your final goal of being in your own career. And then things get a lot more flexible, in my opinion.
I want to piggyback on that. This is my 4th practice out of residency. And part of the reason it didn't work out for me in other situations, one of my partners in my first job said, one year I made $450,000 and it wasn't enough. She said that to me. And I just remember thinking, this isn't going to work out. Like that's fine if that's how you want to live your life. But one thing that I love about clinic, and I agree with what Dr. Larson said about inpatient and outpatient, but I choose my schedule. So I choose when I start, I choose when I take a lunch, I choose my last patient, and I set my life up. Like I said, I drop my kid off on the bus, and then usually I'm home for dinner, which is a stretch because I drive 35 minutes to work and my kids go to bed at 6. So I love that. And I love that, when it's time to go to Disney World, I can take all that time off. I love that. I feel like I've had to really be very intentional about the way that I've built my life, the type of practice I work for, the type of partners that I've chosen. I think it's important to ask specific questions of your potential partners. Look at their list, look at their clinic day. If you are interviewing and you're working with a partner who starts their clinic at 7:30 in the morning and they're seeing patients until 7:30 at night, that's awesome. Good for you. You're not the right partner for me, right? If your partners never take time off and they're even working through doing a colonoscopy prep, good for you. That's not going to work for me. So I think in that way, what Dr. Bancroft said is being an attending can be better in so many ways if you choose it to be, and if you take your power, and if you set those boundaries. I am only recently learning that boundaries are the foundation of compassion. I wish someone would have told me that when I was younger, because it's made me a much more caring physician. I think it's making me a better doctor. And all of that is really hard to see, as Dr. Bancroft said, when you're struggling to get through medical school and your residency, you don't have a lot of choices and control over your life.
All right, thank you so much. One of the other questions is, when does a medical student need to decide on a specialty, and what does that timeline look like? And anyone can answer this one.
So some people are still figuring out, even into their 4th year of medical school. You apply for residency usually in September-ish. That's when residency application season kind of starts. People need to kind of know what they're doing, at least, ideally by the beginning of 4th year of medical school, so that they can do some specialty relevant rotations, advanced rotations in those things. But you have at least 3 years to figure that out, basically. So, most people go to medical school and have an open mind. I think some people, a smaller subset, has a pretty clear idea of what they want to do, and I'd say more than half of those people change their mind anyway. But no, there's plenty of time. You have at least until the end of your third year of medical school.
Okay, and someone asked, I'm still debating on going to medical school or not. What would you recommend for me to do in order to make a decision?
I would say shadow and wait. Maybe getting a job after you graduate is the right thing for you. I think looking back, I felt a lot of pressure to graduate from high school and then go straight to undergrad and then go straight to medical school. But it wouldn't have killed me to take a year off or do Teach for America or Peace Corps or get a job or do anything and figure out what I want to do. I think medical school is a huge commitment with your time and financially. For me, once you sign the line on take out that first year of loan, you're really committed. So I would say just if you're not ready, then don't do it.
We have another question. As medical professionals during a global pandemic, what are some things you would recommend being prepared for as future healthcare providers? What is something you wish you would have done or known before you experienced the pandemic? Dr. Davis Kramer, if you want to go for that one.
So I think we all learned, maybe even globally, we learned that pandemics come and you have to be prepared. For us, the biggest hurdle was getting enough PPE to safely take care of patients. And so the initial problem was we didn't have enough, and yet we had these very critically ill patients coming in, and we had to, so there was a degree of risk, it felt like. And then that was one part of it. The second is so kind of knowing that it can come. And I think the second part of it was the speed with which information began to arrive, scientific information began to arrive. So just personally, during the beginning of the pandemic, there was an emergency medicine forum that would have an update every few days. And then there would be new information coming out. And what was amazing was that we would be learning from the experience of colleagues in Italy or in Spain or China. And it was amazing, but it was really fast. The whole thing felt really fast. And I think it was just a shock to many of us that this thing was real. And but now looking back on it, I think it was a bunch of us. I mean, I think all of us, we did the very best that we could at the time. We did the best that we could. And fortunately now being vaccinated, the shock of it has worn off. And now it's far more routine. Now it feels routine.
No one can do this work all on their own. It requires cooperation with a team. And so invest in your team, strengthen those bonds so that when a pandemic does strike, you've got a great group of people who already know how to get along, how to collaborate, how to cooperate, and that will see you through. So invest in the formation of your team and make sure everyone knows how valuable they are in their role in that group trying to take care of patients.
Okay, we're starting to run out of time. We might go a little over if that's okay, but if any of you have to go real quick, that's fine. But there are a couple of questions about gap years. So did you all go straight to medical school after your undergrad? And what helped you submit that perfect application? And Dr. Bailey, if you want to go ahead and answer that one.
I did go straight to medical school after college, so I did not take a gap year, but I mean, many colleagues and classmates of mine from medical school did do that, and I don't think it has any impact at all. Like it's what works for your life, essentially. Like if it works to go straight in, fine. If you need time, fine too. geez, my application, it's hard for me to remember. It's been a while. You know, I think kind of the things we were talking about earlier, just a big part of medicine is altruism. So kind of reflecting that in your application, how, you know, you want to help other people and your calling, so to speak, of why you want to become a doctor. Yeah, I can't remember anything else. I feel like there was personal statements or kind of questions that got at that core that were part of the applications back when I was applying. And you just, I mean, you answer them truthfully, right? I mean, you want to be transparent and truthful in your answers, and you want to find a place that's a good fit for you to get your subsequent training.
Thank you.
I would say too, I mean, there are kind of two different types of gap years, right? I mean, there's the kind where somebody just doesn't really know whether this is what they want to do and they want some more time to figure that out. And then there's the people that apply and don't necessarily get in, or they get waitlisted or whatever. You know, I think for the people that apply and don't get in or end up on a wait list, I think, you know, spending that year shadowing, volunteering, you know, trying to get more kind of medically relevant. Well, first of all, I guess talking to a medical school that rejected you to figure out why, figuring out weaknesses in the application is actually probably the first thing to do. But generally, you know, also kind of filling your time with shadowing and volunteering. That being said, I mean, maybe it is grades, maybe it's your MCAT score, you know, wasn't great. And so, you know, just kind of figuring out, like, medical schools actually really like it when you ask them, why did I not get in? And they'll like schedule a meeting with you and explain everything on your application that could be better. And so, you know, for those folks, I think just, you know, listening to the feedback you're getting is very important, and, you know, trying to do some medically relevant things. I will say I also just went straight from college to medical school. I don't know that there's a good or bad. I mean, it's kind of nice to just power through, but at the same time, you know, I mean, I didn't like feel like I really got to live my life until I was 26, 29. I mean, it's just like, you know, you're young and you want to like do things, and you get into medical school and you're kind of stuck doing medical school. You can't really do much else. Not really like going on big vacations. And then, you know, you could do residency and you're still working your butt off. So yeah, I mean, I think there is something to be said for taking a gap year and just sort of like, you know, growing up a little bit before medical school and experiencing the world a little bit more, and having some fun too before you take this big plunge.
Can I just add what Dr. Larson said about checking back in, like say if you're not accepted or if you're waitlisted? I think that's really important. And honestly, I had no idea. So I had been accepted to a medical school, and then University of Chicago like has tiered wait lists, and I was in like A, and they're like you know, we go usually down to mid B, C. So I'm just like in Iowa, and I just like, okay, I'm just going to sit at home and wait. I didn't communicate with anyone. And then time goes by, and then I called and I was like, hey, you know, what's going on? And then all of a sudden, like the next day, like, oh yeah, you're in. So I think there's like you need to have that communication. And maybe for some people, Iowans like myself, like you just think, I did my work, either I get in or I don't, I just wait to hear. I think there is some value in following up, and it certainly was for me in my case.
I just wanted to add, you know, I appreciate that perfect was in quotes, so I don't want to pick on the question, but, you know, it doesn't have to be perfect. It needs to be well-rounded, and it needs to represent you. And at every interview I've done, I've always remembered what my mom told me. I was like, Mom, I'm nervous. What do I do? And she said, be yourself, right? Because these people are going to work with you for 4 years. They're going to teach you. So if you have something like, I retook organic chemistry because I got a low grade in it and I wanted to get a better grade, be upfront about that. And it shows that you're persistent, right? Just like calling and saying, well, I didn't get into medical school last year, so I worked for a year, but this is still important to me. But, you know, be honest about yourself and your strengths and weaknesses, because then they will help you to figure out how to be successful as yourself.
Awesome. Thank you all. I appreciate you all for coming, and thank you to the students and physicians for offering up your time and helpful advice. We loved hearing from all of you today. Students, for the next session, go to the Iowa State Pre-Health Conference website for the next Zoom link, and we're pasting that in the chat as well. But thank you all for coming today. We appreciate your time.
It was nice talking with you.